All right, so I'll get started now as people are starting to pull in. So welcome everybody to our closing keynote session. Just to reintroduce myself from earlier, my name is Sakshi and I am the GHSYPS 2020 Planning Committee Vice Chair. I'm currently tuning in from Hamilton, Ontario right now. So before we begin our session, I'd like to quickly just run through some housekeeping items. During the session, just remember that if you have any questions that you'd like to ask any of our speakers, there is a bar at the bottom of Zoom that says Q&A. You can address your questions through that box, and the speakers will have a Q&A session towards the end where they'll be able to answer your questions. Please also note that this session will be recorded and it'll be available after the summit on our website or on our socials. We'll have it available soon after the summit. And lastly, closed captioning is also available for the session in English only, but we also have French interpretation. All you have to do is go to the bar at the bottom of your Zoom, click on interpretation and click French. That way you'll be able to hear another audio channel through our French interpretation. So now, without further ado, I'd like to introduce our wonderful speakers for today. So we have Dr. Gigi Osler and Dr. Vicky Nayantira. So to start off with Dr. Gigi Osler, Dr. Gigi Osler is an otolaryngology-head and neck surgeon from Winnipeg and an assistant professor in the Department of Otolaryngology-Head and Neck Surgery at the University of Manitoba. Dr. Osler is dedicated to the promotion of global surgery and safe, accessible surgical care. For the last several years, Dr. Osler has volunteered on medical missions to Uganda to improve the quality of local health care through education, training, and mentorship to African surgeons, residents, and medical students. Our second speaker is Dr. Victoria Nayantira. Dr. Nayantira is an otolaryngologist and lecturer at Miyatira University of Science and Technology, a mother of 2 boys and a wife. She is a coordinator for the otolaryngology program at MUST and the director for the annual endoscopic sinus surgery dissection course at MUST. She is passionate about low-cost innovations towards medical education and capacity building in East Africa. So now, without further ado, I'll pass it on to our speakers. And again, just a reminder, if you have any questions for them, use the Q&A box and we'll be giving the questions to the speakers towards the end of the session.
Hi, everyone. Just give me a sec and I'm going to share my screen. There we go. Thank you very much for that warm welcome. And I just have to say, it's an absolute pleasure to be with you guys here today. I'm Gigi Osler, and as you heard, I'm an ENT surgeon from Winnipeg, and I identify as she, her. And coming from Winnipeg, I want to acknowledge that I am on the traditional homeland of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. And as you can see from the slide, the talk of our collaborative keynote is sharing power, privilege, and platform with the Global South. And neither of us have any disclosures. And it's a bit of a different format, so I wanted to explain that to you today. I'm going to provide the opening remarks for the keynote, and I'll be about 10 minutes, maybe a little bit less. And then I'm going to invite Dr. Vicky, my friend and colleague, into a conversation. So it'll be a conversation between the Global North and the Global South, and that'll be about 15 minutes. And then Dr. Vicky is going to close the keynote with remarks from the Global South. And as you can see, we've left a good amount of time for questions and answers from you guys to answer any questions that you might have for either one of us. And I wanted to include in my remarks not only some details about the collaboration that we've been involved in for the last 6 years, but some tips or considerations, take home pearls for you for your global health work. And the tips that I want to leave you with are applicable to any work that you do, be it administrative, research, medical, or surgical. My first tip is center the Global South. Nothing about us without us is a slogan that actually has its roots in European politics. And it's used to communicate the idea that no action should be decided upon by any group without the full and direct participation of the people affected by that action. And that means centering the Global South in the work that you do, whether it be administration, research, funding, policies, medical work, or surgical work. And this photo is from our last team visit in January 2020, which with the pandemic feels like ages ago. And here you can see me giving a lecture to the attendees of an endoscopic sinus surgery skills course that Dr. Vicky runs every year at MUST. And MUST, you'll hear us say that, stands for her university, the Emberera University of Science and Technology. And we center the Global South in our collaboration by planning the timing of the trip so that it takes place when it's most convenient for them. We come upon their explicit invitation only. We determine what their educational needs are. So by their surgeons, their colleagues, and their residents. And we work with them to meet those educational needs during our trip. And we pivot the content or the focus of the trip to their local context. And our collaboration began, as many surgical collaborations begin, with a surgical team that goes to the Global South to operate on patients. But over the years, based on mutual discussion and by consistently reassessing their needs, the trips have shifted from service delivery to strengthening their capacity. And strengthening their capacity by teaching, improving surgical skills, and mentorship. And we learned early on that some of the curricula that's taught to ENT residents here in Canada was neither useful nor applicable in a Global South setting. So for example, for a patient with a unilateral sensory or hearing loss, part of the workup in the Global North and what we teach our residents is to evaluate or to get an MRI scan to evaluate that asymmetrical hearing loss. But in the whole of Uganda, there are 2, maybe 3 MRI scans, and the scanners are all located in the capital, Kampala, which is about a 6-hour car or bus ride from Dr. Vicky's hometown. And an MRI costs about $250 Canadian. And Uganda is still classified as a low-income country by the World Bank, which means that the average Ugandan earns less than $3 US per day. So you can see how sometimes the tests that we would order as physicians in Canada simply are not affordable or feasible to the average patient that Dr. Vicky would see. Personally, the collaboration has helped me to find the signal in the noise, and it's helped me to hone my surgical teaching to what is most important and what is most universally applicable. The second tip I want to leave you with is to ground the work in mutual respect and trust. And for us in the global north, that means be humble, be genuinely, openly curious, and be ready to learn yourself and to change. So my work with the collaboration started in 2014. And that was when I joined an informal group of Canadian and American ENT surgeons who were collaborating with surgeons in Uganda. And they had just, the 2014 trip was our first trip to Dr. Vicky's department in Mbarara. And the department had just started up an ENT training program for residents. And it was only the second residency training program in the country. And when I first met Dr. Vicky, she was still a resident. And the Canadian team visited once a year, while the American team visited at least twice a year. And the team's relationship, and by team, I mean the Ugandan surgeons, the Canadian surgeons, the American surgeons, our relationship started off professionally and cordially because we were supplementing the teaching to their residents by giving lectures, administering exams, and teaching in the operating room. But over time, our team's relationship has really grown from one of respectful colleagues to one of mentors and friends. And the photo that you see here is from the 2018 surgical skills course. And you can see Dr. Vicky with some of her colleagues and residents. My final tip is to recognize the power imbalances in the global North-South relationship. And the power imbalance is a result of the inherent political and economic inequalities. And I'll give you an example. Consider AIDS research in Africa. In the past, populations of treatment-naive AIDS patients in Africa became a major draw for university researchers. And the result of that draw has been what some even call neo-colonialism of data, or for data. Because at times the boundaries between research, development, and care became blurred. Authorship and ownership of data was not always shared equally between foreign and local partners. Local partners have different levels of access to the opportunities and benefits that research projects bring. And local institutions may rely upon those very inequalities that they hope to fight in order to establish their authority and presence as experts and researchers. In most global health collaborations, it is the global north that goes to the global south. Why? Because the need is there and the data is there. And it is the global north that has the power, the funding, the equipment, the relative ease of obtaining visas in order to travel to the global south. And if you just think about it, how many times have you seen a team from the global south visit North America? We wanted to flip that paradigm and shift the power. So in 2015, Dr. Vicky was able to come to Canada and spend 4 months with me in Winnipeg to do a clinical fellowship. And this is her in the office, and she functioned like one of my residents would at the time. So she would see patients, she would go to the operating room, she would operate on patients, see patients in the office, and essentially have that exact experience that one of my residents would in the training program. And today, we are also shifting the power by sharing this platform and sharing this closing keynote address. And so with that, I would invite Dr. Vicky into the conversation for a discussion on the relationship. And I'll stop screen sharing so that we can. Welcome, Dr. Vicky. What time is it there in Uganda?
It's a few minutes past, it's 16 minutes past 11. So everyone is sleeping. The whole house is silent. It's dark. Yes. Thank you very much for the honor to be a part of this keynote address. I wasn't expecting this. When Dr. Gigi mentioned it to me, I thought, oh, that's interesting. And then I thought, what an interesting way to have an opportunity to share our perspectives and share what we have been through, the experience of a North-South collaboration. And so I'm very honored to be here, and I thank you for the invitation. I also want to acknowledge any faculty members. I know that there's some that are still trying to join from MUST, especially the Deputy Dean, Dr. Ngonzi, and our Dean faculty, Dr. Gertrude. You're very welcome. And I am honored that you would consider joining this call. Back to you, Gigi.
Thanks, Dr. Vicky. And I wanted to start by asking you the first question. And my first question for Dr. Vicky, can you tell us a little bit about the preparations and the disruptions that occur when a team from the Global North comes to visit the university, comes to visit MUST?
Yes, definitely. So just a bit of a background about MUST and the Department of ENT. MUST is found in southwestern Uganda. It's one of 3 public medical universities. Oh, actually now there's 4 medical universities that are stretched, scattered across the regions in the country. We serve a population that spans beyond southwestern Uganda and stretches into Eastern Congo, stretches into Tanzania, stretches into some parts of Rwanda and Burundi. And so we have quite a wide catchment area. And being a teaching hospital in that region, you can imagine the volume and the capacity that we deal with. That said, our department has 3 faculty at the moment, and they're all women. And right now we have 9 residents, but we have admitted a few more. So starting January, February, we might have about 11. That's all with the inherent, challenges that happen in the Global South. So not very much personnel to go around. And so with that background, it takes months of planning to have visitors from the Global South. And that involves changing call schedules, deciding who will cover call and who will be present for the visit. Because they are geared towards resident training, the residents are usually pulled out of service for that period of time so that they can learn. And so the load of patient care, on-call duties, emergencies falls to whichever senior faculty has been picked on to cover call duties for that period of time. Also, that means private practice is disrupted. It means specialized surgery. So there's only one otologist, a colleague of mine, she's called Dr. Doreen, and I would be the only one to handle all the rhinology cases. And so in that period, in that time when we have visitors, we run an endoscopic sinus surgery course, we run a temporal bone dissection course, And so Doreen and myself have to be away. And so patients that come in with rhinology complaints, otology complaints that are a bit more on the complex side have to wait sometimes so that the students can get taught, or we figure out if it's an emergency. At times when I have pulled Gigi into the OR because we had an emergency and the residents had to stay and study. And so we ended up doing the cases together. Yes, so that's a bit of what it looks like when we have to host anyone from the global north, or host anyone for that matter. Yes.
And so what I'm hearing is that patient care really, like the number of patients that you can see really kind of gets put on the back burner as everything pivots to the surgical trip,
Yes.
to the visitors.
Yes, in a way.
And so I'm curious if you could share with us, because I'm sure in your career you have seen visiting teams and you've seen collaborations that worked and worked well, and then others that didn't work as well. And can you share with us what works for the Global South?
Okay. I have been a recipient of a scholarship that was a result of a collaboration. And so my ENT master's degree was funded through a collaboration between Harvard and Mass. And so I know that there are collaborations that work. The collaboration we have with Dr. Gigi and the rest of the team is another example of a collaboration that works. And what makes these two collaborations unique in their success and the sustenance of the collaboration is the fact that the local needs were put at the forefront. And that means because for Mass, part of the vision is capacity building for community service. We have to train as many and send out as many doctors as possible, particularly surgeons in my case. And so the MGH group, that is Mass Harvard collaboration, came up with a way to do that, and that was to provide scholarships. And what they did was they made sure that whoever applied for the scholarship was willing to be contracted with the university for a certain period of time after the training. In my case, I decided to stay long term because the university could keep me, and because I thought I still had a lot more to contribute. But that is one of the ways in which the needs of the global South were, prioritized. With the collaboration that we have with Dr. Osler and the rest of the team, that's the same issue. It's we sat together at more or less a round table, and I remember Dr. Doreen and myself were quite young at the time compared to everyone else, but we were raised up to the same level and given the same level of responsibility, or given power, like Dr. Osler has said. And this empowered us to speak up and address, the challenges, and speak about the ways in which we wanted these challenges addressed and what was priority over everything else. And so resident training, special skills for the surgeons, mine, rhinology, Dr. Doreen in otology, that was prioritized, and we have grown immensely as a result of that. And now we can run the courses that we do, and which are the only ones of their kind in our country. And we have students or attendees from Kenya, Tanzania, South Sudan, Nigeria, Ethiopia, all coming to attend these courses. And so I think that respect and the contextualizing of the challenges that are in the global South, and prioritizing those because the global South is where most of the challenges are found, I think has been very key in the success of these collaborations. Some collaborations don't work out. And the one that I can remember that did not work out because we could not agree on what was priority. And so if a collaborator comes with their own agenda and they don't voice it from the beginning, you're left in an awkward space and you're left guessing, do we, front our agenda? Do we listen to what they have to say? But then when you listen and you realize that your needs do not fall anywhere in their priorities, you're forced to think again for the good of your community. And I'll be talking a bit about that in my slides. But yes, those are some of the collaborations that have worked and one that did not work. Yes.
And so for everybody who's on the webinar today, Dr. Vicky and I had a conversation earlier too about what doesn't work. And you've probably, I'm going to ask you to do two things. So one is, tell us, have you ever had a collaboration that came in that was more volunteerism than anything else? And tell everybody what you first thought of me when we first met years ago, because I find it hysterical.
Well, I'll start with the last one. So I met Dr. Gigi in 2014. I was a second-year resident that was really being groomed to be part of faculty. And as you can imagine, I was very protective of this program. It was very young, and we were trying. We had big dreams, for the program, and we wanted to see it go places. But we had been banned a couple of times. So when I met Dr. Gigi, I wondered whether she was just a tourist who was, just passing time. I told her this. She came off as a princess who needed taken care of, but did not really understand where our problems lay and what needed to be done and the challenges we're dealing with. And so I thought, this is probably going to be a big waste of time, but I had to be there because I was still a student. This was under university management, so I had no choice but to stick around. And
Thanks, Dr. Vicky. And I think we've moved past that. And even though some people on our team still call me a princess, I like to think I do more than my fair share of the work. And I don't think anybody else would call me a princess, but thank you. Was there anything you wanted to ask me?
Yes, thank you very much. So Dr. Gigi, you have been talking about shifting the power, and I know what that felt like from our end. What was that like from your end, and what was your experience with initially, what was going through your mind when you were consciously or unconsciously making the decision to shift the power, and what did that, work like? What did that look like to you?
I think it was, I don't know. I don't think it was like this conscious, I must shift the power now. It really, oh, hang on. My dogs are in the room with me. They may start barking. Don't bark. Shh. I like to think that I came into this work because I don't have a hidden agenda. So I don't have this hidden agenda that I'm going to suddenly switch up things on you. So I think coming into this work, being very genuine and authentic, and really doing a lot of soul searching before you embark on it, to really think, well, what are my goals? What do I want to get out of it? Because you do want to get something out of it. And for me, it is that altruistic desire to help. If I see a need, I would like to be a part of the solution and to help fill that need. So if there's inequality, I would like to be a part of the work to fix that inequality. And so I think gradually over the years that we've worked together, and then as that trust came, and I agree with you. So Dr. Vicky in the beginning would often, come to conversations and just look at you like this. Very serious. So you always just came across as very serious. And I took that as just a sign of your integrity. You always kept your word. You didn't promise things you couldn't deliver. You wouldn't say one thing or do another. And I know we tried to do that from the very beginning as well. And so it wasn't, I don't think it was this conscious of, we must shift the power, but really in terms of being able to have the department grow and thrive and flourish meant recognizing that we not only had to support you, we needed to mentor, we needed to sponsor, and we needed to empower you. And we could do that through the training and the CPD and the mentorship. But it also came with shifting a lot of the decisions to you and your colleague, Dr. Doreen. So shifting the decisions in terms of what are we going to do on this trip? Are we going to focus on service? Are we going to do all teaching? Are we going to run a course? Okay, well, that very first surgical skills course that we did, we planned a lot of it together, and I'd run courses like that here in Canada. So I knew how to structure it. But then I remember that second year, we would have these conversations and we'd given you all of the tools and just sort of said, okay, Vicky, run it. And you were kind of like, okay. But in the years since, you've just picked it up and you've run with it. Now you have a surgical skills courses that has attracted surgeons from West Africa and Northern Africa, and it just continues to grow. So I think, being very transparent, making sure that you plan for impact in what you do, and make sure that you've got mutual engagement as well in order to make it work. And so for me, it's been very fulfilling personally and professionally to see the ENT department must not only stand on its feet, but thrive and grow.
Thank you very much, Gigi.
You're welcome.
I had several things as you were speaking, and obviously one of your main motivators was what I have decided to call a philanthropic, outlook on things. But it's important that you mention the importance of knowing exactly why you are going into a collaboration, because not everyone is coming in for philanthropy. Some people are in a collaboration because they have to be, because their institution demands that they are. And the other thing I had was, just being honest and open about that, both with yourself and with the people that you're collaborating with. And in our case, I think that came out very strongly, because even the way we communicated that to central administration very quickly got them to buy into the idea of this collaboration and support us in more ways than one. And so, yeah, I think now I see where some of that was coming from. Yes. Just one more question for you, Dr. Gigi. You mentioned not coming in with a hidden agenda, and you talked about being very, well, maybe I'll say transparent. Have you had any North-South collaborations? And I know we haven't talked about this, but have you had any North-South collaboration that was on the other side of the coin?
Personally, no. I've definitely heard from colleagues about collaborations that were not as fulfilling. And I think sometimes, and I'll speak about colleagues who've done collaborations, even in Uganda, not at Must, where they've gone in and not felt that reciprocity of engagement for a variety of different reasons, and may have felt a little bit like, why am I here? And so there's a lot to unpack sometimes in the ones that don't work, and to really understand why they don't work, you would need to get both sides. And so I've heard from colleagues about from their side. I don't know what it was on the other side. And I'll leave it at that, just so you have time to go through your closing remarks.
And so right now, I just want to share South perspectives. And I think I'll just share my screen. Oops. And so just talking about Southern perspectives and where we're coming from, key things, and I think we've mentioned these, some of the reasons for collaboration is, for some people, it's an institutional requirement. It's important if you're going to get funding. For some people, it's for mutual exchange of information and research. For other people, it's because it's a new global trend and it keeps them relevant in whatever field they're in. And then for other people like Dr. Osler, it's philanthropic reasons. Some of the challenges that you may have to think about coming into a collaboration from a Southern perspective is, one, there are always funding issues. There will always be funding issues because of the inherent inequalities. And so in that case, you need to balance their contextual needs versus the funder priorities. And that's always challenging, but when you manage to get that balance, you find that the collaboration moves along a bit more smoothly. And then second is that the people in the South are the ones closest to the challenges being addressed. And so they have a unique outlook on whichever challenge you want to address, and they would know best how it should be addressed because they live within the situation. Some other perspectives that I wanted us to think about was sometimes, and this is, I think there's a shift in how the Global South is looking at these collaborations. For some people in the South, there's a desire to get involved in internationally oriented projects, but then they risk local isolation. And so those are things that as collaborators, we need to be thinking about, is how can we shift the international agenda such that it incorporates local priorities or their contextual needs. The other thing that I wanted us to think about was some people in the South, some collaborators from the South are becoming more cognizant of the needs of Northern collaborators. And that's why I was initially mistrustful about this collaboration, and I kept wondering what was in it for them. And beyond that, though, in a positive way, we need to be thinking about the needs of Northern collaborators and figuring out how to incorporate that into our priorities, because the truth is we need each other. And then the desire to share subjective experiences rather than just challenges is what we are doing with our collaboration, where we just get together and talk about, so what has worked for you in Canada? This works for us in Uganda. How this would work for us in Uganda? How do we bring the two closer together and see if that works, rather than just, leaving it as a challenge or fixating on one collaborator's way of doing it other than the two. And so, like Dr. Osler has said, we've had 6 years of success, tremendous success. If you look at that picture, it's you wouldn't tell that we don't spend a lot of time together, but we spend a lot of time together virtually, online, with this whole team. And one might ask why we have a reverend in the picture. He is actually a surgeon, and he's one of our collaborators from Kampala. The start was slow. We were trying to figure out how to trust. When they shifted the power, it was a bit overwhelming for us, and it took a while for us to realize that the power had been shifted. But when we took that power and we ran with it, and then the collaboration just grew, and the things that we have done have, just swollen from that. So honesty, transparency, and most importantly is open-mindedness, because I believe that this collaboration or these kinds of collaborations can evolve. But if we fixate our minds, which is what was initially the case for me, you fail to see the potential of this collaboration. If your mind remains fixated in a northern perspective, or your mind remains fixated in a southern perspective, then you fail to see the potential for this collaboration to grow beyond what it is. Thank you very much. And so with that, I think we're going to go into a quick Q&A.
Yeah, so if anybody still has questions for either of our speakers, please use the Q&A box to submit the question. So we do have one question here right now, which is for Dr. Vicky. Dr. Vicky, can you speak to the value of traveling to Canada for 4 months of training? Some are critical that such a training experience is not the most cost-effective approach to helping train surgeons in countries that are dissimilar to their home countries.
Yes, thank you very much. We've had this discussion back and forth, Dr. Doreen and I, and while it was expensive, it took a lot financially for me to get there. But the aim of me coming to Canada, the aim of Dr. Doreen coming to Canada was for us to train one surgeon who can then train the other surgeons within the local context. So yes, the training module, or the way in which the doctors in Canada are trained would not work for our setting. And so what Dr. Osler and I did is, I'll give an example. We were doing endoscopic sinus surgery, and the average Canadian rhinologist is going to use a microdebrider, which is a powered instrument. Surgery is much faster, there's less bleeding. When I was training, Dr. Osler and I decided I would train with cold instruments only. We already had the endoscopic equipment in Uganda. We just didn't have anyone to train us in endoscopic sinus surgery, in specialized rhinology surgery. And so the way we tailored my rotation in Canada, or my mini fellowship, was we tried to simulate a situation as close to what I would have to go through back home. And so with that, when I got back home, yes, it was a little bit frustrating initially, but we improvised here and there, because I knew I was coming from a place where I knew what the ideal should be. It then became easy to improvise and kind of figure out what would work in my setting to achieve almost similar result, or even the same result. Yes. And so from that, we have gone to training so many other surgeons with just training one person from a specialized area, and then we can train them and tell them, this worked for me, this did not work for me, this is what we are going to do.
Thank you so much. Dr. Vicky, there's another question for you. Is there any way we can reach out to you, perhaps via email?
Sorry?
Is there any way that attendees can reach out to you, perhaps via email?
Yes, please. That's fine. I will share my email right now.
We have another question for Dr. Gigi. Do you think that there is value in medical staff and doctors from Uganda making a trip to Canada, obviously in a post-COVID world? I think that the global north has a lot to learn from the global south in terms of infectious diseases.
Thanks for the question. And yeah, I think in a post-COVID world, we have to rethink not only much of our lives, but much of healthcare and how a lot of these collaborations will work in the future. And in the chat, I had seen a question about how it's going to work in the post-COVID world, especially with virtual care. And I have to say, Dr. Vicky and I had this conversation, we've messaged each other back and forth, and we had a conversation about that just earlier today, because normally we would do our trip in January, but we're not going there this year because of COVID. And so we've been having discussions about how can we now use technology like this to do some teaching for her residents virtually on Zoom, on this platform. I still do think there is value in having people from the global south come to the global north. And you just heard Dr. Vicky say how her clinical fellowship allowed her to go back to Uganda, and she was really the second surgeon in the country to learn those specialized surgical skills. And as you heard, we adapted it. So a lot of the fancy equipment we had in the operating room here in Canada, we knew she wouldn't have access to back home. So we worked with the same instruments in my OR that she would have access to back in Uganda. And that bringing the global south to the global north has resulted in, I can't even count. I mean, we could probably count, but she's gone on to teach those skills to her residents. She runs a surgical skills course every year, which is attracting more and more surgeons every year. So these skills are now expanding beyond her university to the rest of the country, to East Africa, West Africa, North Africa as well. So I think we have to find a way, and you heard Dr. Vicky speak about it, a lot of the barriers are financial. Some of the barriers are, I'll say political, but obtaining a visa can be difficult for people. And someone may get an opportunity to come. They may be able to save up enough money, but then may not get the visa in time or at all to allow them to come. So breaking down those barriers is important. We were able to time her coming to Canada to do her fellowship at a time where she could do hands-on, because to come as a practicing surgeon, for her to come, she would have to try to get a license, and it would have been basically impossible for her to get like a student license in Canada, but because we timed it well, she could. So a lot of opportunities, especially for surgeons to come to North America, they wind up just doing an observership, which isn't the same hands-on. So I agree. I think there's a lot to learn, not just in ID, but certainly medical training, surgical training.
That's true. Thank you so much for your response. We have another question for Dr. Vicky. Dr. Vicky, what tangible steps would you recommend for students engaging in global health placement in the Global South to minimize disruption and optimize benefits?
That's very important, because we have some students from the Global North coming in and someone has to babysit them. Forgive my language. But the most important thing, I think, is to communicate ahead of time and make it clear in the communication that you have no intentions of being disruptive. When that isn't communicated, because many people in the Global South are still trying to deal with their position, and I put that in quotes because they have I'm trying very hard not to call it an inferiority complex, but they'll always feel like they're at a disadvantage, and so they'll try hard to please. That's one scenario. The other scenario is you could get passive aggressive, like you show up and, like Dr. Gigi said, they'll just stare at you, and they'll be very non-engaging or minimally engaging. And so if you communicate, like find a contact person that you can communicate with, that you'll be working directly with, and make that very clear that you don't want to be disruptive. That means that you'll be fitted into the routine working of whichever department or whichever institution you get to. And I think that has worked for a few people from my end that we've seen, and they fit in just fine, And then while you're there, it helps to really open up your eyes, and if you can take part in innovations that make things easier, it's even better. Yeah.
Thank you. So I believe we only have time for one more question, but feel free to answer questions in the Q&A box if you guys have time afterwards, but I'll just read out the last question for now. So this is a question for the both of you. I'm curious, in your many years of working together, what is the most surprising or unexpected thing you've learned about each other?
I'm going to start by saying the most unexpected thing I learned about Vicky was what I asked her to share with you, that she really thought I was this like princess when I came, and she didn't like me at first because I didn't think I came across like that. But then I looked back and I thought maybe that must be how people interpret me. But yeah, I am not a princess. And I think I do carry my weight, and I don't think people feel like they need to babysit us when we're there. I do feel a real sense of responsibility from my Ugandan colleagues when we are there. They want to make sure you're looked after and you're safe, but I don't feel babysat. So for me, the most surprising thing was that Dr. Vicky didn't like me and thought I was a princess in the beginning.
Just for the record, I like Dr. Gigi very much right now. We're very good friends. The most surprising thing I have learned about Dr. Osler from working with her is that she is a very down-to-earth individual that is not afraid to get her hands dirty to get the job done. There are several times we've finished up for the day with our course, and as you can imagine, it's dissection, there's tissues everywhere, and we have to clean up. And Dr. Gigi will tell the students, oh no, it's okay, go rest, we'll clean up, and we will clean up, Dr. Osler and myself. And so it's been very humbling to see that. And it has taught me a thing or two about being a preceptor and being like caring about people that ordinarily would be doing the work for you. So she's a very humble, very down-to-earth person.
Thank you so much for your responses. And I do see that we have a couple more questions in the box. So if the two of you do have time, feel free to answer that in the box itself. But aside from that, I'd like to formally thank both of you, Dr. Vicky, Dr. Gigi, for joining us today and giving us such an interesting dialogue to reflect on, and something so central to our theme for the summit this year. So thank you very much for joining us today.
Thank you. Thank you for the invitation. Bye.
I'd now like to turn it over to our chairs to give some final remarks and announce our poster or oral presentation winners. Priscilla Hunster.
Sure, so actually I'll start. Before we kind of get into concluding remarks, I wanted to take this time to share the announcement for our award winners. So we're so delighted to have been able to bring poster presentations to your screens this year. Year after year, we continue to be blown away by the groundbreaking research that students and young professionals are leading, and are proud to offer a platform to share this important work. This year, we received over 50 abstracts, and we thank our 40 presenters for sharing insights. And just a reminder that the presentations will remain viewable on our website post-summit. A special thank you as well to the members of our GHSYPS Presentation Review Committee for reviewing the abstracts and presentations. And so yes, now I have the pleasure of announcing our poster award winners. Congratulations to our 2 outstanding Anglophone presentation award winners, Anne Zoan Lan Nguyen, Bridging the Gap, an Innovative Approach to Global Health Learning, and Rochelle Caruso, Innovating for the User, Conducting a Needs Assessment for the Development and Implementation of E-Learning and Paramedical Institutes in Kenya. Now for our Outstanding Francophone Presentation Award. This is something that we were very pleased to be able to offer this year as part of a bilingual program. And please bear with me, but I will give it my best effort here. Congratulations to Sheikh Umar Tiandre Beogo, Pratique et attitude des utilisatrices de la planification familiale dans les districts sanitaires de Léo et Waiguya. And Camille Beaujoin, Women's Empowerment in a Context of Free Reproductive Healthcare and Family Planning in Rural Burkina Faso. Félicitations. Lastly, we have our Outstanding Presentation Award, sponsored by the Center for Global Health at the Dalai Lama School of Public Health, and that goes to Lisa Stallwood, Applying Equity-Centered Principles in an Interprofessional Global Health Course, a Mixed Methods Study. So thank you again to all of our poster presenters, and we're very glad to have been able to provide this opportunity to connect, even despite the circumstances. And without further ado, I'll turn it over to Hunster to close off the day. Thank you for sticking around for so long.
We'd now like to acknowledge some people. Firstly, we'd like to thank our amazing keynote speakers, career panelists, and workshop facilitators. Your words of wisdom and engagement with us today has inspired us all to continue changing and making a difference within our own capacities and contexts, wherever we are around the world. Thank you so much for your engagement. We also like to say a thank you to Francois for providing us with simultaneous French translation throughout the day. Next, a huge thank you goes out to all of our sponsors and partners. GHSYPS 2020 could not have happened without your support. We are so thankful for your ongoing belief in supporting the development of spaces like these, where young people can gather, learn from one another, and grow as individuals. Last but not least, we'd like to now acknowledge the 14 other people that you see on the screen. These 14 individuals from across Canada have worked tirelessly to put this conference on together. On behalf of Priscilla, Sakshi, and I, we'd like to thank you so much for your ongoing leadership, your dedication, and your passion. It has been an absolute privilege and honor working with you and learning from you all.
And last of all, we would also like to thank you, our attendees, for joining us here today. And we really hope that you'll stay connected with us. So we hope you were able to learn something new today, network, and meet like-minded global health colleagues, and be inspired as a global change maker. We hope that you will stay engaged with GHSYPS along your global health journey. You can do this by joining our Facebook attendees group, which, as I've already seen, has already gotten so much engagement and networking going on. So you could stay tuned to our Facebook attendees group, or stay tuned to our GHSYPS social for opportunities, news, and even how to get involved with GHSYPS 2021. Lastly, we will also be sending out a feedback survey to get your input on how GHSYPS can continually improve, and there will also be a chance in the survey to win a prize. So hopefully you'll be able to complete that survey and give us your input on how we can improve GHSYPS. And with that, we are at the end of the 7th Annual Global Health Students and Young Professionals Summit. We hope you enjoyed it as much as we've enjoyed planning it. And thank you, stay safe and take care.